we have seen so many patients, and I have cooperated with some of the multicentric research which was happening, related to this hemodialysis patient. Actually, that was completely focusing on AV fistula management. Then there we came across, the patient feeling all this fatigue. They are facing so much problems. So that is why, then we developed some exercises and which was helpful for them. So since you have came across and requested that this might be helpful for everyone, I just hope we will be a help for everyone whoever is suffering from this fatigue and the problems related with this. So the first thing for the normal person, this is since the classes for hemodialysis technicians, I would like to tell that you people are doing an amazing job, and you will be knowing that the functions of kidneys. These are the normal functions of kidney. To remove the waste from the body, balance the salt and the minerals, then make the urine, so get rid of the excess fluid and the waste, and balance the fluid and the fluid control. Then maintain activate the vitamin D level. So once the kidney lost its start losing its function, then that will all this previous the normal functions of kidneys will get imbalanced. So that is the time we are thinking about dialysis. That also, in case if the progressive kidney function loss will be there for more than 3 months, that is the time we are thinking about the kidney dialysis. So this you people know properly. So this is going to help us, which is already lead to the toxin accumulation and fluid imbalance. So now you know that what is dialysis. This is nothing other than a renal replacement therapy. So in this, what we are trying to do is, when the kidney cannot remove the waste products and excess fluid from the body, renal replacement therapy will be removing the metabolic waste and maintain electrolyte balances and remove excess fluid. So just giving a very, very simple introduction. There are 2 types of dialysis, as you know. One is hemodialysis and the second one is peritoneal dialysis. So in this, the hemodialysis, today we are going to focus only on hemodialysis patients. Okay, the physiotherapy, we are mainly focusing on hemodialysis patients, where the blood is removed from the body, filtered through the dialysis machine, and clean the blood and return to the body. So the first picture, as you see, this is the way you are doing it. So peritoneal dialysis, that physiotherapy is totally different. So we will be talking maybe somewhere upcoming sessions about it. So today we are just mainly focusing on hemodialysis patients. So as you know, these are the vascular axis for the dialysis. So the first one is, as we told, an AV fistula, which is very common. AV fistula, arteriovenous fistula, we'll say. The second one is arteriovenous graft. The third one is central venous catheter. So, why we are talking, why we are focusing more on physiotherapy is, the patients whoever is undergoing hemodialysis, they will be having the physiological problems like muscle wasting. So they will be telling that the moment we see some patients, we can understand the first day, whatever the day they undergo the dialysis, and maybe some after 3 months, the same person, the appearance of the same person, it is totally different. You can see so much muscle wasting, and they will be telling that, okay, you have gone down so much, you have reduced your weight. This is the way almost all the people, they are going to comment on the patients. So that is one thing, muscle wasting all over the body, not only in the hardened muscles, all over the body. Then reduced aerobic capacity. They will be keep telling about the moment I just went to the washroom, after that I was just flat in the bed. I can't do anything. Or if you are telling them to walk for a while, just 3-meter walk, 3-meter walk also, it is going to be really hectic for them. So it is because all these things because reduced endurance and reduced aerobic capacity. So which is going to lead to the severe fatigue level. Then the third, next one is balance problems. The patients, they keep telling that we are having the balance issue. It can be related to any type of neuropathy. Since diabetes is one of the main reasons for this end up in dialysis, so that can be also one of the reasons where the proprioception is completely lost and the patients will be having this balance issues. So balance issue also the frequent fall also will be one of the reasons. So these are the physiological problems in dialysis patients what we are going to see. So which is going to completely reduce their quality of life. So how physiotherapy is going to help? Here we will be able to improve their functional capacity, where the endurance will be improved and the quality of life also will be improved. The second thing is increase the muscle strength. We will be trying, in the initial stage, we will be trying to maintain the joint range of motion as well as the muscle strength, where the patient won't be having that muscle wasting, that atrophy won't be happening. So very simple exercise, very simple available things which is completely economy, that we will be able to train the patient and the patient will be able to maintain their muscle strength. And once the functional capacity is improved and the strength is improved, naturally the fatigue level will be reduced. And we can completely prevent the deconditioning of the patient. And through all these things, we will be really able to improve their quality of life. So the people will be really wondering. How we are going to do this during the when we conducted a class, they were just asking that pre-dialysis, during the dialysis, post-dialysis, what is that? What they literally asked us that what nonsense you are talking about. So, but the pre-dialysis is really help the patient when we are able to train them that with the simple breathing exercises. The simple breathing exercise in the sense it was just a simple diaphragmatic and thoracic mobility exercises which they can just in lying, just a supine lying, just in the bed itself, they can do that exercise. So that simple exercise. But the patients really came up saying that their endurance level is improved. Even after the people who has already undergone dialysis also, they were telling that after doing this simple breathing exercises, they are in the position to do something better. Okay. The next one is range of motion exercises. We will be wondering that why we are doing this range of motion exercises. So this range of motion over the period of time, in case if you are not doing, for simple example, if I am taking the shoulder range, in case if you are not doing the complete range of motion, the shoulder, we know that it's 180 degree. So maybe the patient will be lifting the hand only up till 90 degree. Imagine the patient is lifting the hand only up till 90 degree. Over the period of time, the pectoralis muscles, it will go for tightness, naturally patient will be having that stooped posture. That itself, it is the protracted and the stooped posture. They will develop a protracted and stooped posture. That itself, over the period of time, the quality of breathing, the oxygen intake, when they are in a stooped posture, the quality of breathing, that is going to reduce completely. So that itself, it is going to cause all these problems, reduce the endurance, reduce the cardiopulmonary capacity, that it is going to increase the fatigue level, that it is going to reduce the quality of life. Everything, it is interrelated. So range of motion, it is really important. So one is not only we are not focusing only on the shoulder, we are just focusing from head to toe. from head to toe, each and every muscle like we are concentrating. So and that also with simple multi muscles like we will be focusing and very simple targets which patient will be able to. That's what I just told you before. In the supine line, in the bed itself, patient will be able to do all these simple exercises. We will be concentrating from head to toe. So that like we will be able to prevent the muscle wasting, and there will be the quality of life, like as the sir has informed, sir was mentioning in the beginning, the going to the washroom, just normal doing the grooming, the quality of life, all these things like it will reduce. So in physiotherapy, like if in case if they are doing like a physiotherapy on daily basis, which is very, very simple exercises, they won't even feel that they are doing the exercises. So such things like if you are daily making it as a religious practice, that means like religiously if they are doing these exercises, we can give you the guarantee that like their quality of life will be improved. So most of the time, like we have seen that. But that is a certain part that in India we are not focusing on during dialysis, like the exercises. Most of the I don't know the reason for it. Most of the time they are not allowing exercises during dialysis. But it has been shown that there are so many studies which is proven that during the dialysis also we can do the exercises. We can do the exercises, and the patient fatigue level also it will reduce. And the main thing what we are doing is exercise monitoring. Once before giving the exercises, we have to check all these things. Some parameters we have to check. That is blood pressure, then SpO2 level, heart rate. All these things are must. If the vitals are normal, then we can continue with the exercises during and after dialysis also. But there are some warning signs, in case during while doing the exercises, if they are getting the giddiness, it can be because of hypotension, or in case if they are getting severe muscle cramps. That means we know that there are so much lactic acid production is there, so the blood is blood pumping, everything it has been reduced, an anaerobic exercise, anaerobic pattern is happening. So that time also we just need to stop the exercises. So post dialysis, after the exercises, after what is the dialysis, in case if they are doing the gentle stretching, relaxation, again the breathing relaxation. It is this diaphragmatic breathing. Let me tell you, this is really fantastic ones. So once they are completely relaxed, and if they are able to do this breathing exercises properly, we have seen that amazing results for the patients. Then very light walking. So first we will be telling them, the simple thing, first we will be telling them, keep the alarm for 1 minute. And in the even surface, maybe in the room itself, just walk. The moment alarm rings, they just have to come and rest and do this breathing exercises. So once if we will be monitoring that time also. So in case if the patient is in the position to walk for 1 minute, next time we will be trying how much time they can walk. So imagine our target time is 3 minutes. So if the patient is able to continue do the walk, walking without getting fatigue for 3 minutes, and it's a very simple walk. It's not a brisk walk. Their own pace they can walk. It's not that we are not giving any special instruction to them, but only thing is we will be doing the breathing exercise prior, and during the walk also we will be training them how to do the breathing properly. So in case if they are able to cope up with that, then that 3 minutes walk we will be continuing for another a week's time. Then slowly we will be increasing up to 6 minutes. Then from there to 10 minutes. There are some criteria for that. So 10 minutes. So maximum is half an hour. But this process and the progress is very slow in the sense, from 3 minutes to 6 minutes, though we are just telling that 3 minutes to 6 minutes hardly take any time, but that 3 minutes itself, it is too difficult for them. As you people will be knowing that how difficult it will be to continuously walk for 3 minutes for this dialysis patient after dialysis. Okay, if we are doing this type of breathing pattern before and during the walk, that the quality of life also, that breathing, the walking pattern is also really improving, really improving, and without getting fatigue, they are able to walk also. Then we will be training them the little balance training, where they are. I told you, as in the beginning, I told you, they will be having all these proprioceptive deficits, where the patient is going to have some balance issues. So we will be training them all these proprioceptive balance training exercises, where they will be completely recovering from that, so that their gait also will improve. So this gentle stretching, it is going to really reduce the muscle stiffness and the cramps, the word what we have used in the beginning. So if you are doing this gentle stretching, gentle stretching, it is also like a warm-up exercises. So which is going to reduce the cramps even. The lactic acid production also, it will be reduced. Instead of anaerobic, it will become aerobic exercises only. So aerobic pattern. So it will reduce the muscle stiffness as well as the cramps. Then relaxation of breathing. It will really reduce the fatigue, as I told you, and improve the oxygenation. So completely, all this cramps and everything, all these exercises, whatever we are doing, it is interrelated. Light walking, that is going to improve the circulation and improve the endurance also. Balance training, as I told you, it is going to prevent the falls and improve the stability of the patient. So now comes the fistula maturation exercises. So this is what we are going to give them as 10 to 15 minutes repetition. This is that smiley balls, what they are talking, the smiley balls which is available in the market. So hand grip exercises using the soft ball. We are not supposed to use any hard things on the fistula hand. So all these exercises, whatever we are mentioning, not on the fistula hand only, this soft ball exercises. Okay, the proximal muscles can be treated. So for example, imagine the fistula they have done on the wrist. So you can do maybe elbow exercises as well as shoulder exercises, but not on the wrist. Only this soft ball, without bending the wrist, we will be teaching them. Okay, it is going to really help in vein dilation and fistula maturation. So as a technician, these are the things we just need to be very, very careful. No BP measurements on fistula hand, so that is going to damage the fistula. So by mistake also, we are not supposed to put the BP measurement, BP cuff on the fistula hand. Okay. The second one is no IV injections. That is going to, it is going to really have a risk of infection and the thrombosis also. Then comes as I told you, very simple light exercises I told you. Avoid any heavy exercise on the fistular hand. Fistular hand, there are some special exercises which needs to be done. The exercises, whatever we are mentioning, that is on the other side and the lower limb. So heavy lifting may cause the fistula rupture and the bleeding also. So whatever means, maybe we may end up redoing all this things. The last one is don't allow the patients to wear any tight clothing. So that is going to compress the blood flow again. So these are the instructions you have to give to the patients, and also avoid the BP measurement on the fistular arm. no IV injections to be given. Like, then in case if they wanted to do the exercises also, don't allow them like on the fistula hand, like with the heavy weight exercises. So these are the things like I told you. These are the contraindications. So in case while doing the exercises or like you are just seeing, like before giving any exercises, we will be first monitoring. So in case if there is any severe hypertension, so just imagine like you know that like kidney functions, kidney one of the function of kidney is like to manage the BP also. So in case if there is a severe hypertension, like we are not supposed to continue with the exercises. That time the rest is the best. Okay. Then severe hypotension. Severe hypotension also, like that is the patient is saying that like no, I'm having severe giddiness. I'm not able to like soon after the dialysis or during the dialysis, if the patient is telling that no, I'm having like a syncope type, like a dizziness, then suddenly like just stop the exercises. Okay. Then the thing is like the next is active exercises. Like so when they are doing the exercises, the systemic stress will be there. The blood pumping, everything, it will be more. So whenever we are doing it, if you come to know that there is an active infection, like please stop the exercise. Like don't do any exercises. Exercise may worsen the situation. Then most of the time, like the patient will be like as you people know that like the patient will be like slightly anemic, like the blood. In case if the patient is, if you come to know that patient is severe anemic, I'm mentioning the word severe anemic. In case if the patient is severe anemic, then like don't give the exercise. If it is just anemic, like and they are telling that like the patient normally will be anemic only, like that time we can continue with the exercise. Like but if it is a severe anemic which is related to the fatigue and which will directly like club to this the fatigue level, like then it's better to avoid exercises. Then there are some possibility of during the exercises, like there are chances like the patient will complain about like some chest pain. So there also like it's a warning bell for us. There are possible cardiac ischemia. Like so that is the time like again we just have to stop the exercise or don't give the exercise. Okay, like these are the evidence. Like it's already been there. Like that these are the evidence-based benefit of exercises. It is just going to. There are so many papers related to that. Better, it is really improving the better cardiovascular endurance. So the exercises for this dialysis patient, it really improves the cardiovascular endurance. Then it improves the functional capacity, better walking, better daily activities. The main thing is like you have to come up with a protocol, better quality of life, reduce fatigue, like and improve the independence. The patient will be able to like roam around. Most of the time, it will be like the moment the dialysis starts, like the patient will be like they are just put in the jail type. They are not able to come out, and they are even the family members also will get scared. So I know some patients like they're just roaming around like and they are doing like the daily activities. They are leading a normal simple life, and with confidence. That's the beautiful part of it. So the last one is increased muscle strength. It is preventing the muscle wasting. So like the bulk of the muscle may be like the slightly, but not they will look fit. It is not they will look like a patient type. So it will prevent the muscle wasting even.